these guys. I'm not going to stand here in front of a camera and tell you that weak calf muscles directly cause back pain, because I don't believe that to be true. However, weak calf muscles can lead to inversion of the foot and improper gait and lead to other pain up the kinetic chain. We're going to break this down and tell you why lower leg muscle development is so important relative to spine health. Tune in, let's go. Welcome back and thanks for tuning in. We're talking about the lower leg muscles and its relation to spinal health. So the lower leg muscles consist of the tibialis, which are in the front of the shin bone, the tibia here, and wrap around the foot and insert actually at the big toe. And the calf muscles, the gastrocnemius, which is the bigger outer layer of the calf, and the soleus, which is the inner layer and actually have a more dominant focus on dorsiflexing the ankle when you flex your toes up to your shin. Okay, so you might be wondering, what do calf muscles or lower leg muscles have to do with spinal health? And as I said in the intro, I don't believe that weakness in the calf muscles have a direct correlation to lower back pain. However, there is a cascading effect with weak lower leg muscles that could affect your gait, the pronation of a foot. There are also postural muscles, and there are first postural muscles that go up the chain. So if we look at the bottom from the ground up, from our feet up, anything on the back of our body, the calves, the hamstrings, the glutes, the rectus spinae, the lower back, they hold our body up, they hold our posture together. And the first ones we have are the calf muscles. So having these calf muscles be strong and mobile through their full range of motion is important when it comes to lower back pain. Now, coming back to the gait and pronation of the foot, this is a problem that many people with back pain have experienced before. You may have been recommended some orthotics, like I know I was definitely experiencing some pronation in my feet, and I had recommended orthotics, and I wore them for a while because I worked long hours on a construction job site where I would be in uncomfortable steel-toed boots, and you would be in uneven surfaces and terrains that it ended up affecting my lower back for sure. So I wore orthotics, and then I got to the point where I had to actually look at what I could do about the foot and the lower leg muscles. And if you need a direct approach and you're really suffering from pronation of the feet, or actually reconnecting your mind to your feet, then you might need a more personal approach for strengthening the muscles beneath the ankle, your toes, and there's all sorts of exercises you can do. Feel free to book a call with me and we can discuss those things further. However, we're going to be discussing mainly the calf and the tibialis, which are enough of a remedy and a treatment to usually sort out minor foot or calf lower leg muscle imbalances. Most people have very tight calf muscles. If you look how we spend our day-to-day life, we're never really in maximum ankle dorsiflexion or plantar flexion. We spend time in these inner ranges where we're walking around or sitting, where we don't actually fully plantar flex or dorsiflex our ankles. This is where we could use a good ankle mobility drill or a stretch. Simply, if we have a wall and we get our heel as close to the wall as possible, our toes against the wall, keeping our legs straight, zhuzh around here, move around here. You can drop our heel to the floor, keeping legs straight. You're gonna feel it behind the knee and a bit higher. However, I like it where most people are really tight, and that's in dorsiflexion, with our toe closest to our shin bone, our tibia. So keeping the legs straight, driving our heel into the floor without our hips coming back too much. This is where you're gonna feel it towards the bottom of the calf, the Achilles tendon, and stretching, getting long, breathing into more range of motion. After moving through both sides, because I can't just do one in front of you, we would do some strengthening exercises. And I'll show you what those look like for the calf. Utilizing a wall, we're gonna have our hands about shoulder height against the wall, stepping back until our heels are elevated. Here, we're gonna squeeze our glutes, and now that my heels are not touching the ground, I'm getting a stretch in the calf muscles in the bottom position of this exercise. So all we're gonna be doing is pushing up through the toes as high as we can, holding at the top, lowering down slowly back up. Okay? Doing these for a lot of reps is going to help strengthen the gastrocnemius because we're using straight legs which focus on that bigger calf muscle. Okay? Once they get easy enough, you do one leg. Moving on to dumbbell loading, where you would hold a dumbbell in your working leg side. You could always move on to an elevation as well. High enough where your heel gets lower than your toes, making sure you get a stretch at the bottom. That's for the gastrocnemius. For the soleus, this is arguably a more important calf muscle. You don't see it, it's not the bigger one. However, it is the inner calf muscle that helps dorsiflex. So it has a bigger role in ankle mobility, which is very important. To do this, we simply just have to bend our knee and perform a calf raise. So if we come a bit closer to a wall, hands a bit lower, bend our knee, keeping our chest up, we're gonna just literally push through our toes. Moving to one leg. Keeping hips forward. Moving to dumbbell loaded. So the soleus are a little bit more awkward to get into. However, they're basically just doing a calf raise with a bent knee. We're trying to avoid any hip hinging, keeping our body stacked, shoulders above hips. Feet go back. Try these out. Let me know how you do for the calf muscles. For the tibialis anterior, big shout out to Ben Patrick, knees over toes guy, who made this exercise more, it's not mainstream yet, but it's definitely more popular than it was 5 years ago. Okay, so our hips against the wall, our legs completely straight. We're gonna flex our toes to our shins, like so. Okay, no bending the knees. Okay, if you want a bit easier, bring your feet closer to the wall. You can lean back, harder, a bit further away. So you can see the lever gets further, becomes harder. These are definitely harder with the heel on your shoe as well, because they have a little bit of a surface that's elevated. Squeeze at the top. You can do some turns. Try and get to big toe, outside toe, big toe, outside toe. And we do both sets for the tibialis and the calf in high volume, 20 to 30 repetitions. They're slow twitch muscle fibers, meaning they respond to higher volume. And they're very important to we need to stimulate these muscles, so we need more of them. And often they are neglected when we look at regular training programs. Not many people throw in calves, specifically tibialis as well. So we want to do them for high volume so we get a good response and some adaptation. There we have it, the lower leg muscles, the calves and the tibialis in their relation to spinal health, how they could be affecting you, how they could be stopping you from progressing on back pain, and some areas of opportunity that we can focus on to strengthen them through their full range of motion, improve our ankle mobility, improve the strength of those low postural muscles. And if you found this helpful, please consider liking, following, subscribing. I'm at The Full Range on Instagram. If you're looking for a more customized approach to your strength training, please book a call with me, shoot me a DM, get in contact, leave a question in the comments if you want to see anything further on back pain. Thank you for watching as always, and I'll see you on the next one.